my son had autism in 2015, right? So I have been to so many conferences. I've listened to all sorts of subspecialists from gastroenterology, neurology, genetics. I've listened to so many things and in trying to help my son. And so when I there's so many tests out there. There are hundreds. And if you're gonna try to, and a lot of times people will go on TikTok and they'll see a test and they're like, oh, that helped that person. I want to do that test. But I always say, for me, because I'm more internal medicine, I say, oh, do things in a systematic way. So you can't start off. It's like building a house. No, I'm not a builder. I can use
Yeah,
this example a lot. You
yeah,
can't start off with just putting the roof on. You don't have the foundation. You just start off with the foundation first, and then you build on it. So there are many tests out there, but first I want to look at the blood, because just general blood work, like looking at a comprehensive metabolic profile, and that looks at your liver, it looks at your kidneys, look at the electrolytes, and then general things like iron, like looking at your iron, hemoglobin levels. So I chose those basic tests because sometimes you can find so many things wrong. Like someone will come to me and they say, my child is just putting everything in their mouth. They're eating, dirt, they're eating a lot of ice, whatever, they're putting it in their mouth. And when they go to bed, they have a lot of time restless. They're kicking, moving around, can't seem to get a comfortable position. And they'll say, well, I don't want to get blood work because my child cannot tolerate a needle stick and it's going to be traumatic. But I will not go any further unless I get some blood work, because I have seen from my experience that I've done labs on someone and their hemoglobin is like 7. They have severe anemia. Their ferritin, which is a iron storage, is like 5. So it doesn't matter what I would have done, what sleep aid I would have done for that person with that restless legs, or what I might do to try to get them not to eat dirt and ice and all that stuff, having pica. It would not have worked because the problem was they had a iron deficiency. So I realized that the blood work, there's all those things that I do with the blood work.